Hi, welcome. I just wanted to make a little announcement because several people have asked me, how do I choose between the two sessions during the breakout? And is there going to be a video of the other session? The answer is yes. And we wish we could do a longer program, but you won't have to miss anything. A couple of weeks, a little bit after the summit, we will get these videos up and you can see what you missed. So don't feel deprived. Pick either one, you will get to see it. Anyway, let's get started. I'm very excited to introduce David Huseby. He's the security maven for Hyperledger. This is a big blockchain project, and this is the latest magical word, right, in healthcare? Blockchain. What's blockchain going to do? So we're going to get to talk to him, and just to make sure that the questions for people who know very little about blockchain and technology are answered, I'm going to do the interviewing instead of our Chief Technology Officer, Adrian, to make sure that it's really, that we really start from the base and move up to more technical things. So let's get started.
How close do I have to be? Oh,
yeah. So do you want to say a few things about yourself and Hyperledger first?
Sure, yeah. So as she introduced, I'm the security maven, which means that it's my job to coach all of the open source projects at Hyperledger on how to do open source software correctly. That's sort of the general term. I have a long background in security and privacy. I previously worked at Mozilla, and then I worked at Linden Lab, and I've done work in aerospace and gaming, all kinds of stuff. So all of it's been mostly geared towards platform security is sort of the general term. Okay. Hyperledger is an industry group that's hosted by the Linux Foundation. It was created to fulfill the need of cross-industry cooperation for blockchain technology. And the reason it's at the Linux Foundation is Linux Foundation's mission is to build foundational technologies that are used for things like, little things like the internet. So the Linux Foundation has the Linux kernel project, and they have the Apache web server project, and OpenSSL, and lots of foundational technologies that are used in all of the electronic systems that we have today.
Can I ask one really dumb question?
There's no dumb question.
Why is open source so important to you? It sounds like that's mainly where you've worked.
Yeah. So
or maybe what is open source?
Yeah, let's start there.
Really basic. Okay.
Let's start there. So open source software is sort of the counterpart to commercial software in the sense that it's software that's developed in an open and transparent way. It's an open community. Anybody is invited to participate. It's a spontaneous cooperation to build some piece of software. So Firefox is an open source web browser. So back when Firefox started, when Netscape open sourced their browser, they released the source code to Netscape. And almost immediately, the Mozilla Foundation was created, and a whole bunch of developers all over the world, and translators and artists, and it's a really beautiful community, just people from all walks of life, said, hey, we all like these web browser things, let's make the best one. And let's make one that can be owned by the people almost, right? And they all collaborated and coordinated and built the Firefox web browser, and it's still a beautiful browser today. So open source is used to just leverage everybody's individual talents and their motivation to build tools that we all can agree are, good and work, right? They're not free from security problems, far from it, but the theory is that the more people you have looking at something, the fewer errors there are, right? And so this is why almost every foundational technology that requires trust is an open source project, is an open source piece of software. So the Linux kernel runs basically all of the servers on the internet because everybody has to trust the servers on the internet. So they want to know that it's running an operating system that hundreds of thousands of people have looked at, and it's trustworthy. The Apache web server is a good example. MySQL database is a good example. And very specifically, just to kind of head us back in the direction of blockchain, well, in fact, every piece of encryption software is open source. And the general rule is that if you can't see the source code for encryption, you can't trust it. So the thing you're trusting to keep your data secret is a piece of software that is almost certainly open source.
And that means that millions of people will be looking at it.
Yeah, or that it's completely auditable, right? And there are regulatory issues about this too. So like if you want to claim safe harbor, you can say, look, no, it's open source, it's been audited, all that kind of stuff. It's not some piece of software that we incorrectly implemented and that's why our clients all lost their whatever, right? Like open source has many, many utilities, both in legal, regulatory, and just general trust.
So it's good stuff.
Yeah, it's really great stuff. And it's actually fun. I mean, pretty much all of my friends that I know all over the world I've met through open source projects. So you want to be a cool kid, get involved. Because I can go to Paris and I have a half a dozen friends that are like, hey, you're in town, let's go drinking. You know, like if you want to be one of those people that just has friends all over the world, open source is how you do it.
Sounds good.
Yeah.
Sounds good.
It made me a cool kid. Well, in my mind.
you're-
In my mind, it made me a
Dave-
cool kid.
You're cool. You're cool.
All my friends were like, nerd.
Okay. So now that you've explained open source,
Yeah,
here's your big question.
sure.
What's blockchain? What does it do? What doesn't it do? And let's start there, and then we'll get into how it applies to healthcare. How about that?
Sure.
Okay.
So,
Because it's a magic word. You have to
I
really,
realize.
you have to get really basic.
I realize.
Really
It
basic.
sounds like it came from a Harry Potter novel, actually. So, blockchains are a new way of storing data. Think of them as similar to a database. But the data is organized in a way that as more data is added, the data that was added previously becomes more and more secure, because to modify that data that had been recorded previously, you would effectively have to rewrite all the data that has been added since then. Okay? And so you can think of them as write only. I don't know if that's too far of a computer science term for you guys, but write only meaning you can only append data to a data structure or to the blockchain, but you can't ever go back and delete it. You can't ever go back and rewrite it or change it. You can only just continually add to it. So that's
So
what a
it's-
blockchain is.
It's immutable.
It's immutable,
And-
yeah.
And it's a ledger. That's
Yeah,
why you call
yes.
it Hyperledger.
Well, yeah, they call them ledgers because they're very similar to how a bank handles transactions. They never delete old transactions. They just say, well, $100 went into your account, now $100 went out of your account, and then, it's a continuous ledger of all of the transactions that happen in a bank. So that's where you're getting all these terms. Like it's a ledger, there's transactions. The blockchain itself is just how computers themselves store those transactions. And they're stored in such a way as to give end-to-end integrity. So if anything ever changes, you can immediately spot it, right? And you can continually, anybody can look at it and go, yep, all the data in this blockchain is correct. It has not changed since it has been written to this blockchain, okay? And that is one of the first key pieces where we can start building trust on the data itself, which then leads to the other problem that it solves, which is called distributed consensus. Now, distributed consensus is what it says. This is not a fancy term. It's how do 5 people come to an agreement about something, right? The New York Yankees are the best baseball team ever. Let's all just agree on that right now. We can do a distributed consensus. Right, I'm in DC now, aren't I?
Yes.
You can boo me, it's okay.
Different team.
But it's exactly what they mean when they say distributed consensus. It's a bunch of parties coming together and coming to a conclusion. And that conclusion is that the data in the blockchain is correct. Okay, that's all it is. Hopefully that dispels some of this. It's when you start talking about applications of blockchain that you start getting into like esoteric stuff. So there are 2 different ways that consensus is met in these networks of participants. One is called proof of work, which is Bitcoin, okay. And related cryptocurrencies. I can solve a math problem faster than you, and because I solved it first, I get to make the next block in the blockchain. And that math problem is the throttle on how fast blocks are created and which transactions get into the blocks and all that stuff. The other way is proof of stake, which is more in a line with the rest of the world because it requires all participants in the network to be known or to be permissioned is what the word is. They call them permissioned networks. And you can think of this as like, let's say the PTA at your school.
Okay.
The board members of the PTA are permissioned. They were elected or they volunteered or whatever, and they are entrusted with making the decisions for the Parent Teachers Association and helping out with the teachers and all this stuff. So when they come to a consensus, they are permissioned representatives for all the parents who come to a consensus that, yes, we're going to do end of the year gifts for all of the teachers. Okay, so most of the world uses permissioned networks, and blockchains are being applied to that segment just as much as they are for cryptocurrencies, because like proof of work in Bitcoin is a very narrow application. It's just currency. And basically every other system we have relies on some credentialing, some permissioned network, right? All the banks in the SWIFT network that clear their books at the end of the day, they're all FDIC regulated institutions, so they're permissioned to be on that network. They could use a permissioned blockchain to clear their books at the end of the day. In fact, there are a lot of pilot projects to look into this. When you're talking about healthcare, you have credentialed physicians, and you have regulated insurance industry, insurance companies, and they could participate in an EHR system that uses blockchains to back up not necessarily the storage of patient data, but the transactions related to patient data. So, and that's just sort of steer us back into, so that we're on topic here. Yeah, so I hope everybody in here is going to go, yeah, I think I get it now.
Not yet.
Not yet? Okay, what's the next question?
Okay. Well, there's a lot of hype about blockchain, like that it can create security and privacy, but is that true? Privacy being defined as your ability in healthcare to keep something private.
Yeah, so we're going to, okay.
As opposed to, security breaches, that kind of thing.
Sure. So that is a function of the application of blockchain. Okay. And I should point out that Hyperledger is not in the business of application development. Okay. We're in the business of building the tools that make blockchains a utility, something that you can deploy. It's a foundational technology. It's the bricks you build your house from, right? That's what Hyperledger is focused on. But we can get into the application stuff, and we should. Okay. Before we go there, though, I wanted to make one last point, which is the reason why everybody's talking about blockchain now is because it's a solution to one of the last computer science, like big computer science problems. Okay. When computers became a thing back in the 50s and 60s, there were a whole bunch of problems that had to be solved, like how do you store data in a computer? How do you sort data in a computer? There are countless numbers of mathematicians and computer scientists who wrote their PhDs on just how to sort data faster, right? And then it became, how do you store it at large scale, like big databases? And that dominated the computer industry through the 80s and 90s, and we got big companies like Oracle out of this. So these were huge problems that computers could be used to solve. And there was this one persistent problem that nobody had ever solved, and people have been working on it for decades, which was how do you create distributed trust when the people participating in the network could be adversarial? How do you do distributed consensus? Okay, and there's this anonymous person who goes by the name of Satoshi Nakamoto, wrote this paper back in 2008 that said, hey, if you stack these things that we already know, how to do a proof of work, how to do hashing, how do you do all this stuff, you can build a system where everybody's adversarial and you can still get distributed consensus. And then when that happened, everybody went, wow. Okay, now let's look at the computer science behind this and figure out how consensus is created in this system. And now we have these systems that have moved on. Like we have all of these applications. So it solves this last big problem. And there's basically anytime you have an industry where you have people who have to cooperate and they have to all agree on the state of the world, you can apply blockchain to that. You can apply a distributed ledger to that. And that's why this is all you're hearing about, because it's the last big problem. We all have databases, we all have web servers, we all have browsers, we can all store huge amounts of data, we can all back it up, we can encrypt it, we can sort it. But now we all have to agree that it's correct. And we all have, or not correct, but it has integrity, that it hasn't been modified.
So it's really good for knowing that the data are not altered, but it doesn't reveal the data.
Well, this is now you're venturing into applications. Okay. So
Okay.
You asked me if it could be used to protect patient privacy and security. The answer is yes. The application of it could be. There are a number of groups that are working on this. They're starting with the identity problem, mainly.
Oh, yeah, please talk about that, and use of blockchain for identity. It's
So,
supposed to help with that, right?
yes, because you can create a distributed consensus that tracks all of the transactions that would be related to any credentialing.
Like an MD or an RN?
Or I was born.
I was born, okay.
Right.
There
I
are
was born-
debates about that,
Yeah.
don't forget.
Or that I live in Nevada, or that.
Okay.
I'm from Las Vegas, by the way.
Waving at Stacy, yeah.
Yeah. But yeah, you can build a system where you can do computational proofs that are cryptographically sound, so meaning you can trust that no human has messed with it or no computer has messed with it, to do automatic credentialing. So the DEA does this with physicians who are allowed to prescribe controlled substances. There's a database. You can say, here's their DEA number. Is this person credentialed to do that? That works because we all trust the DEA in this regard.
Yeah.
Okay, that's the system we've set up.
Yeah.
But if you apply blockchain to this, then we can have public utilities that are run by nonprofits that can prove that, yes, I'm an American citizen, or yes, I'm a credentialed physician, or yes, I'm over 21 and can buy alcohol. And it can be an automatic thing. That's why people are really excited about this, because I could have a smartphone
Yeah.
that I flash at the bartender, and he scans it with his smartphone, and it comes back with a big thumbs up and
You're over 18.
yay, you're over 21, you can buy the alcohol here, right? And because we trust this distributed consensus and that it's backed up by real records and all that stuff, that yeah, that's a proof that I'm over 21 that they can trust, okay? And one of the neat things about this is if we design the regulatory framework correctly, that could then provide that bartender a safe harbor, because if we all agree as a society that we're going to trust these systems, then the bartender can go, well, I just saw the green check mark, right? Like, that's all I'm ever required to verify. And so I'm not liable for that person, their bad decisions. This is getting into law, and I am not an expert about this at all, so take that with a grain of salt. I'm not a lawyer. But there are a lot of advantages to these systems because it creates a distributed trust framework and transitive trust. Yeah. One of the neat things, so what I was getting at here just a second ago is that in terms of privacy, we can build systems, like blockchains could be used as like the most horrible surveillance system in the world. It can be an immutable record of everything you've ever done. It's 1984 on steroids, okay? We don't want to build that. So if you ever hear anybody saying, I'm just going to record everything in the blockchain, just shake your head and just walk away. Just like, no, that's not right. It's not how you do that. But it can serve as an immutable record of manipulation and access to data.
So we could have accountability
So that you can have
and
transparency.
Who's been in your record?
Yes. So I'm very new to the healthcare industry. I don't really know how it works, but I would assume that if I sign a disclosure form at a hospital, that I'm also allowing anybody at the hospital to access my medical records. I'm assuming that's true. I don't know that's true, but maybe it is, maybe it isn't.
Pretty close to true. Some hospitals have role-based,
Okay.
but they don't have it to where it's just your physician, and then whoever your physician writes, whoever fills the orders or
Okay.
does the procedures that your physician orders, then they get to see your record.
Okay.
So right now so maybe blockchain would enable that kind of protection from the other 9,975 out of 10,000 people that work there only the ones that are, maybe it could enable only the ones that are working with
Well-
you to help you, the ones that are treating you would be the ones that would see you? Is that possible?
Well, the access piece is an application, but I would say that my ignorance of
Okay.
how my records are handled
Okay.
is directly a result of not having a blockchain that I can look at. So if we were to deploy this where all access to my data, all additions to my data were recorded in a way that I can audit them, then I wouldn't be so ignorant. Because I would, next time I go to the hospital for any reason, I would go, just because I'm curious, I'm naturally curious about this stuff, I would go and see, like, oh, okay, this physician looked at it, this, you know, this is what happened to all my data. Here were the records that were added, here were the records that were changed, just to see. And I would be a lot more informed as to what data they have on me and how it's handled.
That's what we thought. That's why we worked in the last major electronic record reform, high-tech, to try to get the right to accountability and transparency
Yeah.
into it. And we were supposed to be able to get just what you're talking about, an accounting for all disclosures from all the different hospital data sets. But the regs have never been written.
Huh.
So we don't have it yet.
So it's politics.
So good luck.
Big surprise.
Yeah. It's politics. Yeah, I think it's politics.
So I want to make one point, touch on something earlier when they were talking about the GDPR and compliance. One of the panel members here said, what we really need is like a really great, like immutable way of recording all the accesses to the data. And if anybody requests to have data deleted, have a record that cannot be deleted, you know, like once we've recorded it, that will always be there that they had requested that it was deleted. And then when it's deleted, we can record that. And I was sitting there thinking, yeah, it'd be funny. Like, what kind of technology would solve this immutable record of the access and management of patient data? And this is why GDPR comes up all of the time. Almost in every meeting I'm in, we're talking about compliance and how it can be applied for this. But just to get back to privacy, I'm actually going to take my Hyperledger hat off for now because on a personal note, I came from Mozilla where I worked on web surveillance and web privacy. And prior to that, I worked on Second Life at Linden Lab where we did a lot of privacy related things because it's people of all walks of life are there and we did all kinds of privacy protections for people.
What kind?
Just like
Just
allowing them
don't
to.
know Linden
It's Facebook stuff. So it's a big virtual world. Second Life, if you don't know about it. And there are adult-oriented subcultures in Second Life, and who are very, very keen on maintaining privacy because they literally were second lives. You know, people who live one life in the real world then go and pretend to be somebody else in a second life in this virtual world.
Okay.
And so that's when I really got into privacy. It was about 10 years ago.
Okay.
But we've been fighting this fight for a decade. And listening to everybody here, I was just kept thinking that when we were finding solutions to defend people's privacy, we ultimately came down to the fact that this is an information theory problem. This is a math problem. It's not a regulatory problem. It's not a legal problem. It is legitimately a math problem. Total data sovereignty and embargoing personal data is mathematically impossible because you would have to be completely isolated from society to maintain airtight privacy. At some point, you have to go and tell a doctor that my tooth aches, or a dentist, my tooth aches. At some point, you have to tell, you know, somebody else that you think they're cute, right? Like at some point, you have to talk to other people. You have to convey information. And that information, if observed by third parties, can be used to correlate things about you.
Of course.
Right. It's just like, you know, if I go to Target and I buy car seat covers for a truck, the fact that I bought car seat covers for a truck, Target can make the assumption that I own a truck, right? It's a correlation that, because why would I buy car seat covers for a truck if I didn't own one or if I wasn't riding in one or whatever, right? So just by having a third-party observation of some action, you can confer or infer, I guess, other things to be true about a person.
Yeah.
And on the web and on the internet, they're super good at this. It's in real time, and it only takes a few bits of data to uniquely identify you and uniquely track you across every web page you go to. And so when we were modeling how to fix this problem, we realized it was a math problem, and that the only way to do this is to slow down the data that gets released and to make sure that the data is not precise. And what I mean by that is you would have to disclose data that was not unique to you, but was something unique to, say, the class of people you are in. So let me see if I can explain this better. So if what this gets into is aligning technology with people's reasonable expectation of privacy. For instance, me personally, I have no problem with companies knowing that I'm a man and that I live in Las Vegas, right?
Okay.
Because there's exactly, what, 1.2 million men who live in Las Vegas. I think that's
okay.
like reasonable privacy.
You think you can
for me.
hide? Okay.
Yeah. I'm pretty sure I can hide amongst 1.2 million,
Okay.
right?
Okay, just ask.
What I do have a problem with is that they know that I'm Dave Huseby and that I live at this address and that I visit this Starbucks and then I go here and then I like to do this on the weekends, and like knowing all of these other things about me that they then use to get out ahead of me and predict my future behavior so that they can be the store that I drive by next, or that they're the ad that I see on the next web page, and that the message is tailored very specifically to entice me. Like, I don't want them to be out ahead of me in terms of my behavior. So I want the data to be imprecise enough that they can't individually identify me. I'm part of some bigger class. And I think if you just talk to people, next time you have a cocktail party at your house, ask them what they think about what their reasonable expectation of privacy is. And my litmus test is, does my mom feel like her privacy was violated? Because she's not technical. But she does come to me and she goes, how did they know that, I wanted to do this? And I'm just like, because they're not nice people, Mom. And they built a system that's tracking everything you do, and you're typing in all of your information into every form on the web. That's how they know this. And actually, it's not even that. It's like you need to just turn up your privacy settings a little bit. So to get back to health.
Okay. Yeah.
In the LGBTQAI,
Yes.
Did I get them all?
Yes.
In that panel,
IA.
Sorry, excuse me. I think it was it Amy that was giving the talk? No, it was, I don't remember who it was. I apologize. But they had said to the effect that physicians are reporting transgender as endocrine condition, otherwise unspecified.
Yeah. Unspecified endocrine disorder, yeah.
Okay, this is a perfect practical example of giving imprecise data to protect privacy. Okay, this does not tell anybody that they're a transgender person. This just says that they have an unspecified endocrine
That's right.
condition.
Endocrine disorders are much broader than what sex you are, absolutely.
Exactly,
yeah.
and I think what they've found is that this is a sweet spot of we can report just enough data that the insurance company is happy and will reimburse whatever medications or whatever that are prescribed, but they won't violate the patient's privacy, right?
Okay.
And so what I want to see happen when you apply blockchains to build these systems is that you do what's called hierarchical data, where you have macro data that has less protection around it, all the way down to like the fine-grained stuff where I have total sovereignty over it. So I don't mind that my insurance company knows I'm a guy and that I like to work out and I like to do these things, but they don't need to know that I broke my distal metatarsal 4 years ago and it still bothers me sometimes. And they don't need to know that, but my podiatrist does, right? My GP would. And so what I would want to do is if it's really bothering me and I want to go on a hike and I want maybe some treatment for it, I could go to my doctor and I could issue an authorization for them to one-time access that data, or at least the treatment history of that condition that I have, and then go, oh yeah, okay, did that last medication work for you? How did that work? And I'd be like, yeah, it worked great. Okay, here's a prescription, right? And then have them report it to the insurance company as, muscular skeletal issue, right? Like they don't have to tell them that it's because I had a broken bone in my foot. I'm hoping that's the system we can get to.
No.
Yeah, well, so
okay, yeah, maybe I shouldn't talk as a doctor, but here's the problem. as a psychiatrist, I did a lot of that imprecise, I think, what did you call it? Yeah,
Reducing
imprecise.
precision. to
Yeah,
protect
and I
privacy.
might have told you all this before, but, virtually every psychiatric or addictive diagnosis is horrendous. It'll destroy somebody's life. So who wants to do that? And you want to help people. So pretty much everything until we're up against the wall is anxiety disorder not otherwise specified. And that's called downcoding. But the problem, of course, is with the medical records now, if you put down a diagnosis, all of the other supporting data better be there, or else you're a fraud, possibly.
Oh, you're saying you could be
Yeah.
accused of prescribing
like,
medication
yes.
to people who are just addicts and not really.
Something, yeah, exactly. And so we're kind of caught in a trap, and we used to be able to protect people. But this is such an interesting idea about, really, the truth is you might not know this, but also the law changed to where physicians went from, what was it, y'all, about 25,000 codes to 250,000 codes, okay? Let me just
Wow.
ask you this, all you patients out there. Do you think that having more names for what's wrong is going to substantially help your treatment? Well, a lot of them are fragments of diagnoses, and then there's just weird ones like ran into a light post or bitten by a parrot or something,
That was my favorite.
But
I went to my doctor and said, "Can you just put it down as bitten by a parrot, please?"
Yeah, no, and it's created a whole new. Actually, it's a job creator, right? Because who's going to learn all these anyway? But it's mainly driven by the billing and insurance industry, so that they can capture every possible thing about you to bill you. So it's a problem. I mean, anyway, I think this is a great point for. We have 10 minutes of questions for him. Please come and ask him, particularly about health and how this can work or not work for us. But, the idea of imprecise, is immediately appealing to me because I'm in a sensitive specialty.
And there's one other piece of technology we're starting to see now that's privacy enhancing, which is, you said you would have to have this extra data, right, to support that kind of a diagnosis. When you start putting data in these structured formats and you're tracking it with a blockchain, you make them things that you can do computations on.
Yeah.
Okay, you make the data computational. And then there's this whole other branch of mathematics called zero knowledge proofs. And it would allow you to cryptographically, to securely prove.
Put the proof there.
Prove that you have the supporting data without disclosing it.
I wonder if they'd buy that.
It is it's a mathematical thing. This is not whether you should trust me or not. Math is math. It does 1 + 1 = 2.
Okay.
These zero knowledge proofs are math formulas, and they're statistical ways of proving something to be true without actually disclosing the pieces. It comes from a long-standing problem of you want to buy my land, I want to know you have the money, and I'm I want to know you have the title. Right, so
Trust,
there is a way to do this mathematically using information theory, game theory. So we can do zero knowledge proofs without disclosing this kind of stuff. So you could eventually protect your privacy of your patients and still protect yourself by doing a zero knowledge proof that you've done due diligence as a physician.
Adrian, you want to start, and then we'll go to you.
Yay, Adrian. This guy grills me all the time, by the way. I like him.
I like you. So you mentioned two things that I think I'd like to dive into a tiny bit deeper. You mentioned the importance of blockchain technology for identity management and for credentialing.
Yes.
And one of the things that sort of drove the huge investment in Bitcoin and the progress that it made as a currency is the fact that it enabled people to interact as individuals across borders and without worrying that they were unbanked. So it became a very popular way of, say, doing remittances from a rich country to a poorer one. Now, in the case of currency transactions, people then had to scramble to put back the know your customer laws, the anti-money laundering laws, the functions of a bank as a trusted institution. And you mentioned the issue about having this consensus, for example, or whatever it is. But now, when we apply this and I completely agree, this blockchain identity and credentialing component to healthcare, to health records, all of a sudden now the principals, Dr. Peel, with her DEA number, no matter whether it's republished or managed by some other intermediary, are now, we're back to the days of paper prescriptions, where there didn't have to be a hospital involved.
Correct. Yeah, this is reestablishing the original order of medicine.
Okay.
That sounds good.
Yeah, I mean, it's, and
Doctor, patient.
it's like encrypted email restored the original order of writing letters, and why the Fourth Amendment says persons are papers, right? Like papers.
So there's two questions there. So first of all, do you agree that this is a qualitatively more interesting application of blockchains than just currency transactions?
Absolutely.
Okay. And
absolutely,
the
without
second thing,
doubt.
which again gets to the Linux Foundation mission, as you described it, is will this introduce a new way of scaling health records, where we're no longer concerned about health information exchanges as institutions or even hospitals or the data brokers that we like to talk about at PPR occasionally, that the scaling problems as a foundational technology that, as you mentioned, the last problem that we know of so far in computer science, will this change the scaling rules by taking institutions out of healthcare?
No, but by shifting the power back towards the patient and the principals acting on this, we can use blockchain to enhance the portability and to enhance the cooperation between all the industries. Like right now what you have is siloed data. The hospital has a big pile of data on you. Your insurance company has a big pile of data on you. With blockchains being a ledger that tracks all of the access and manipulation of this data, we now have a real reason to say, no, you guys all need to pool the money, or sorry, pool all the, wow, that was a Freudian slip.
Oh dear.
Pool the money. You mean I meant the records? Pool the records all in.
Yeah, that is what it is. It's very valuable.
And in some way that, like, wasn't the purpose of HIPAA to be portability?
It
right?
was the
health
you're correct.
Health
Portability.
Insurance, portability
And Accountability Act. And we don't have portability or accountability, so this is great.
And honestly, I would hope that in the same vein that the Sovereign Foundation is trying to build a public utility for identity, that I would love to see a health records foundation or a health records nonprofit that says, you know what, we're just going to run a whole bunch of servers and we're going to store all your data encrypted in these things as a nonprofit service. And we'll actually be a principal on the blockchain, and then everybody else will participate, because the health records are not going to be stored in the blockchain. They'll be stored off, and they'll have to be in a database, a traditional data store. But then the access and validation of all that will be recorded in this blockchain that will be a public utility. And I would like to see this data.
Good.
I would like to see this data just like, you know, through osmotic pressure, get pushed into sort of these nonprofit entities that we as a society can be like, yeah, you know, it's great. I mean, I would love it if when I wanted to go vote, if I could give the polling place a verifiable claim, which is a cryptographic proof, that they then run against a blockchain that the
Las Vegas voter registration.
whatever, yeah, or like you know, any civil rights organization, and have them go, yep,
he's a person.
he can vote in your jurisdiction.
In this place.
And I didn't have to disclose who I was or how old I was or whatever.
Yes.
I gave that
would
the
be ideal
data.
for voting, yeah.
Yeah.
Next question.
Great discussion. Thank you to our host and David for flying out from Las Vegas. Dan
Sure.
from the Government Blockchain Association.
Government? Government
Blockchain
is working on
Association.
blockchain, wow.
We're trying to brief federal, because we're here in DC, but global governmental organizations about these issues. So David, blockchain, we see it as an opportunity. Fraud is rampant in the $1 trillion level globally in all types of fraud, and certainly the WannaCry virus. I think as a globe, we're craving security without a loss in functionality. So could you put a sharper point on that trade-off? Technology is neutral, we talked earlier.
Yeah, it's just a tool. It can be used for good or for evil.
And then maybe a smart contract and how that can enable some of these higher security with greater functionality.
So let me take what a smart contract is. You guys are going to start hearing this too. So what I was saying earlier is when you start storing data and managing it using a blockchain, managing the access to it in a blockchain, you can make it computational. And a smart contract and a verifiable claim are, all verifiable claims are smart contracts, but not all smart contracts are verifiable claims. And really what it is it's just a piece of software that says to any computer that's participating, it says to that computer, if you go and look at this piece of data and you do a calculation on that data, the answer you get will be this. Okay, and I can claim that I know the answer, and I can say, look, I know this record exists, and that smart contract will say, verify that this record exists, and that record could be my birth certificate, right? So the birth certificate exists. I was born. Okay, so that could be one thing it has to do. Okay, and then the other has to do like extract the date of birth year, right, and subtract it from the current year. Okay, and then store that number. And then if that number is greater than 21, then this entire smart contract comes back as logically true. Okay, I was born in a year that's more than 21 years ago. So the answer to that verifiable claim is true. So it becomes like a logic puzzle that a computer can solve. And we can trust that it's true because the pointers to the data are stored in a blockchain that can't be ever changed. And the data itself has integrity checks that are also stored in the blockchain. And so by looking in the blockchain, you can prove that the document existed, that it hasn't been changed, and therefore the data, and that it exists, and that the data that's on it is valid, and then you can do this automatic calculation to say, yep, he can buy alcohol. And it's all backed on cryptography and math, like numbers so big that you could count all the stars in the universe multiple times, right, and never run out of numbers. So it's really big math, really solid science that allows us to do these operational decisions.
So you think science is going to fly in the current environment?
I mean, I assume that it's...
I'm hopeful, but
I think the
I'm
reason
sure.
we went to science was because the common sense argument
Didn't work.
Doesn't
Didn't
work.
work.
No.
Tom? I'm sorry, this will have to be the last question. He's fabulous, but he's here all day. Okay?
I have to take off in about an hour, but
an hour?
I have a meeting tomorrow morning in San Francisco.
Okay.
So, but I'll be out and
Okay.
about to answer questions.
Okay, thanks.
Since you came at this from a mathematical paradigm at one point,
Yeah.
I want to ask you a question in that perspective. I think blockchain is a good possible next solution around privacy. At what point, though, let's just say I'm Google, and currently at the moment I can do 100 trillion correlation operations a second.
They can already do that, I think.
Though they can. They're over 100 trillion.
Yeah.
They're over 100 trillion. So with that processing capability and that correlation mathematical modeling capability, at what point does having blockchain become irrelevant? Because there'll be enough individual data points out there that I can correlate those and be very specific on who you are, what treatment you've had, where you're going, what your mental health is going to look like for the next 50 years in a mathematical probability modeling perspective.
Yeah.
Is there some point in time that you see that making this other conversation irrelevant?
No, I think this modifies that conversation. So in the world, we don't have any real privacy. In fact, I think I just read a couple weeks ago that some AI was able to diagnose cancer like 6 months before the doctors could.
Yeah.
I mean, that's how good correlation's getting.
Yeah.
But I think, I mean, I'm not a politician.
Well,
I'm
let me
not.
ask it another way. Can we use that modeling? So Joe Kanatachi, who's the head of the United Nations
He's a-
Privacy and Security,
First special rapporteur for the right to
Rapporteur.
privacy.
his concept is a sphere of privacy.
Uh-huh.
So in other words, there needs to be a capability where that sphere of privacy is defined so that correlation of data then cannot pass through that membrane,
Yeah.
the sphere of privacy. That's a total different conversation than what we've been having here.
No, it's exactly what I was talking about earlier. So I think that model's wrong. I'm just going to say it right out. Because it's based on the assumption that you can have total privacy or not total privacy. and
No,
that
it's
that
based upon you can define privacy and then have rules as to who can access it.
Okay, so maybe that's in line with what I was saying. So,
I think it is.
so
That's
the
what
stuff
I'm
that's inside the sphere would be the extremely precise data that I would have sovereignty over. But the stuff that's outside that sphere is sort of the more broad stuff, like I'm a guy who lives in Las Vegas. That's not really secret. In fact, there's a million ways to determine that.
Yeah.
And just by me going to the store, you would know. So, or me hitting a web page where my IP address was revealed. I like that model, and I think that's only possible with blockchain, honestly.
Okay, well, that's
Thank
a good
you.
answer.
Thank you, thank you, thank you. I hope you all learned something about blockchain, at least a little, and
Oh, yeah, we were up to
we really appreciate you coming here and talking.
Anytime.